I hope you had a chance at break to meet at least one or two other new people that you haven't met before. I think our tendency is to gravitate towards the people we know best, go back and see the people we work with on our units, and yet this is such a great opportunity to have the folks together from all around the hospital. So please, as we take breaks at lunch, just be bold and put yourself in a seat right next to somebody you haven't had a chance to meet before and get to know them and what drives them and how we do the process. I was chatting during that break with somebody and we were talking about any process like this. And there are the people that seem to step right out in front and lead it. And then we all know there are people that tend to sit back, and it's kind of what I call the show me state, you know, the license state. It's like, I'll see it when I believe it. I've been here a long time. I've been through these things before, and they really do want to see something demonstrated or proven. And something I've learned along the way is, I call it the kind of war or battle that we all struggle with in a process like this. And the only reason I use the term war is not to be violent, but because it's an acronym for words, actions, results. And something that has been incredibly learned, look at your own observations. Actions follow words and results follow actions. So it really goes in that order: words, actions, results. If you're speaking with anyone, it could be in a clinical patient care setting, it could be at a meeting like this in a planning setting, and you're talking to somebody and the first words out of their mouth is, I don't think that's going to work. Guess what? Their actions will reflect no intention to make it work, and the results will be very low. If on the other hand you're having the discussion and the words out of their mouth are, that is a great idea. It's not that I have any solutions right now, but I really want to drive, what can we do to head that direction? Guess what? They're going to come up with the ideas because their actions will follow their words. So think today and kind of police your own table, if you will. If you hear any of the words that are the stopping words, the negative words that, I don't think that's going to work because, let's accept it for a moment with further consideration to say, well, should we keep that noted down? Maybe there's a way in which that will work. So as we go through the process of divide and conquer, this is where we get to engage all of your brains. And we're going to do it by looking at how do we flow from the mission to the objectives to the things that you all have in your ideas today. So we're looking at the nursing mission, and the way we're going to break up the room today is in the center of the table, there are some handout sheets, and there should be plenty for each person in the room to take a copy. This is what you're going to be working with. We have it divided up. We're saying tables 1, 2, and 3, you have nurse objective 1. Tables 4, 5, and 6, nurse objective 2, and it goes that way through the room. All suffice to say, there are at least 3 tables working on the same objective simultaneously. Our goal is to generate as many ideas as we possibly can. And when the Transformational leadership group got together, we were talking about, if we look at the nursing mission, they kind of settled on this draft of to provide best practices for best outcomes in education, research, and patient care. Does it need to be any more than that? That is what nurses do. They really provide the best practices for best outcomes in what we do. It's that simple. If you look at existing mission statements, they're about a paragraph and 4 sentences long, and if we even asked you to go back and memorize it, and then asked you a month later, what is that nursing mission again? We tend to forget it because it's just words, it's not what we live. But we're going to have several tables today just looking at the vision, the mission, and the values to say, what are your table's ideas? This was just an idea that the Transformative Leadership Group came up with. We're going to do this process by something called brain writing. Now, if many people have worked with me, they've probably somewhere along the line been involved in a brain writing process. How many people in the room, you are familiar with brain writing? So just a handful, that's very typical. Let me explain the difference between brain writing and brainstorming. Brainstorming has been a technique used for generations, and it's a way of getting creative ideas out on the table. Let's brainstorm about this idea, and let's see what we can come up with. Brainstorming has some inherent flaws in it. Brainstorming often doesn't work because if we toss out the ideas to this table, and let's say John is the first one to speak up and he puts his idea out on the table, immediately the other 4 people involved in the discussion, having heard that, are going to go towards that idea. And then if I picked up on it and made a comment, then you picked up on it and made a comment, before you know it, the idea that we initially had gets lost because the table discussion has gone around that one vocal person. Also, certain people can dominate, certain people are more articulate, certain people are persuasive. So whatever happens, we all get clouded in a brainstorming environment by the dynamics that are taking place at that table. Brainwriting is very different. We want to capture what is in each and every one of your brains. So there will be a first exercise of working independently, and then from there, we start to bring that to a collective group. The rest of the day is to take all those collective ideas, and we'll start to filter them, so that we come up with the best of the best of the best of the ideas generated at your table. So here's the way that the brainwriting works. If you go ahead and make sure everyone at your table has one of the sheets and you have something to write with. And the example that you're going to have is, at the top of your sheet is your objective. The 7 objectives that we're working with today, those have come from the Transformative Leadership Group. I'm just going to connect the dots for just a second. As Stuart Smith gave an overview of the Medical Center Strategic Plan, there were about 42 or 47 driving tactics. Well, we got together with the Transformative Leadership Group and said, of those 40 plus driving tactics, which ones in nursing can we most affect? So we did exercises to come to the priorities, and we came out with the ones that are at your tables today. What we need your help on is, how do we build those objectives to be the strongest that they can be and make sure that they work? So this is the process, and I'm going to come back to the brainwriting with very clear instructions. I'll give you a chance to ask any questions that you may have, and then we'll start the actual exercise. As we look through the goals that we're going to do long term, we will not get fully to this point today, but we want to set what are just known as SMART goals. And many of you have worked with SMART goals. They're used as part of lean process and the improve process. And a SMART goal is just one. Is it very specific? Do I know exactly what it is that we're supposed to do? Is it measurable, so I know whether we achieve success or not? Is it achievable? Sometimes we set too aggressive goals. Is it relevant? In other words, can I see the connection and the alignment in this goal is going to help us meet what is our overall objective? And is that going to help us meet our vision and our mission? And is it time bound, so that we know the time period within which those goals are to be achieved? So that's a deeper level to let you know, as we get your good ideas out today in terms of the goals that will support the nursing objectives that are on your table. We'll be looking at this checklist to make sure that we have really good goals. If you have the time today to really take it to the next level, you're just helping us advance the process. But we just want you to understand what that process is for now. So, 2 heads are always better than 1, then imagine what we're going to get at a full table. So here's the way the table exercise is going to work. Number 1, I need a table leader that's just responsible for the facilitation, the organization that's taking place at each of your tables, so we don't lose control of the room. The easiest way to pick the leader is, I'm going to give you literally 30 seconds, and in that 30 seconds you have to decide who has the most seniority at your table, and then that person is to stand up. I want to see someone standing at each table within 30 seconds. So, any questions about that? Wait, we have a question. Hold up, no. Seniority is the length of years that you have been with MUSC. All right, thank you. So 30 seconds, go. Who has seniority and stand up? Got 1, got 2, got 3, got 4, got 5, got 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. Stand up, 25, stand up, table 16, stand up, table 16. Don't hold up the entire room, table 16. And that'll do it. Now, I like to say that privilege comes with seniority. So your privilege is, you get to sit down, but you must pick who at your table will be the table leader. Stand up, all right? Pick them, and you sit down, and they stand up. So I know every table has a table. Good, 2, 3, 4, 5. I need every table, stand up. Got to know where our leaders are. Got about 3 tables, you have to go. They shouldn't be hard. Pick and stand. All right, we got 2 tables. If you're late to lunch, it's table number 3, holding us up. Table 3. Stand up. Stand up. Meeting, money, you're it. All right, great. We have somebody on the table. Let me just speak. You keep standing because I want to make clear the role of the leader and see if any of you have any questions. You're really there to facilitate the process. That is it. Making sure that as we get into roundtable discussions, I think the simplest thing is when you're seeking input, and I'll give you directions to do that, just start with the person on your right and go around the table, and you will either keep the list of the key things coming out, or you may designate someone at your table to keep the list. You are the leader of the table, so it's up to you. So if you would like John to be a scribe, just say if you'll keep notes for everybody and you'll facilitate the discussion, it is up to you. Be prepared as a table leader that should you be called upon to make a report back of something that your table discovered during the process, then you'll either report back or you've at least acknowledged somebody at the table, would you report for us? I find whoever keeps the notes is the best person to report. So it's just, if you want to keep them, if you want somebody else to keep them, I'll leave that to you at your table. You're really just there to facilitate and keep us on track. If you have any questions, if you feel like your table is getting confused or stumped, come find me, all right? I'm in the room, so come find me and I'll come help work with your table. Fair enough? All right, you may have a seat. You are going to find that we are going to generate somewhere in the neighborhood of about 2,000 ideas over the next 20 minutes. So don't you think we should be able to come up with the best of the best of the best if we start with 2,000 plus ideas that we're going to come up with? Here's the way it's going to work. I'm going to give you increments of 60 seconds. In the first 60 seconds, with a sheet of paper in front of you with your objective at the top, I want you to read the overall nursing objective that you're responsible for. You are to work completely independently, no table discussion at this point. Got that? Complete independence. I want your brain. You are simply going to answer the question that is on your sheet. I believe what we should do to clearly state and promote our vision and mission is, or I believe what we should do to clearly meet this objective above is what? Begin your 60 seconds. Three, 2, 1. Finish your existing thought and then set your pen down, please. What I'd like you to do is now pass your pages to your right. So a counterclockwise fashion, pass it to the person to the right. So what I want you to do now is read the sheet of paper of the person just passed to you. And we're going to take a few, just about 30 seconds. If you cannot read a word on there, or you don't understand their basic thought, take a moment to say, what is this saying, or what did you mean by this? Because I want you to understand what they were thinking when they wrote that. So read their thoughts, take a few seconds, and see if you need to check with them. So just talk as you need. So let's bring it back into one discussion again. You're going to go on round 2. You will now have 60 more seconds. On this 60 seconds, I want to be very clear. If you had other ideas that you were on track and you did not get a chance to put them all down in the first 60 seconds, just keep on your mental track. If on the other hand, something that someone else wrote down that you're now looking at their idea has sparked a new idea, or you want to add on to that, it is 100% your choice. You may continue your existing thought. You may build off of their thoughts. It's whatever you want. You have another 60 seconds to give us your genius.